Hey everyone, welcome back to the BioNexus Health Podcast series. Today we'll be speaking to John from New York City, and John will talk to us about his journey with chronic illness through many years with Lyme disease, mold biotoxin illness, chronic inflammatory response syndrome, unbeknownst to him. All of these conditions were cloaked under various symptoms that he had over the years. And, it was deemed to be allergies or fatigue, and many other such diagnoses that were given to him, although the root cause wasn't found until we really dug deep. But let's welcome John and let's speak with him and hear in his own words what his journey has been like with natural medicine and herbal medicine.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
So hello, John. Thanks for being here today. I appreciate it.
Good afternoon, Dr. Dashore. Pleasure to be with you.
Awesome. So, I'm in New Jersey. You're in New York City, so not that far from where I am, right?
Yes.
So let's jump right in and talk about your journey with chronic illness, everything that you've been through. I remember when I first met you, you told me that you had read my book on biotoxin illness, and you kind of suspected something might be going on with you. And I also remember that you mentioned that you've traveled a lot, like Brazil, UK, Japan, I don't know, right? Several countries around the world. And
Yes, I was pretty much a world traveler. So I'm not sure, I assume that contributed to the situation, but I was exposed to a lot of different climates and cultures, a lot of different foods as well. Japan, they eat, a lot of raw food as well. So a lot of things possibly could have contributed to the condition that you diagnosed. So so let me know. I could get started in terms of kind of the journey. I'll try to be brief and concise, but it started about 10 years now. It started.
Okay.
Yeah. So basically, I manifested with a variety of symptoms. Most notably was all of a sudden I had food allergies I never had before. I had food-induced anxiety, like after I'd eat, my heart would race and I just feel really miserable, probably pretty much the best way to put it. And I also had a whole bunch of situations with gastrointestinal issues, as well as eventually it affected my heart. So I ended up in the emergency room a few times where I had, heart palpitations or a racing heart. It was quite startling, for me. And then, so about 10 years, I experienced. I guess I lived it for 8 years, and then I met you about maybe 9 years. Maybe I met you about a year ago. But up until then, I went through either some holistic doctors as well as traditional medicine. No one was able to pinpoint exactly what was wrong. A lot of the blood work and everything that they tested for didn't show anything that was out of the ordinary. So no one could really pretty much put a label on it. I had a fairly demanding job, jobs, 2 careers during that time period. And it was very difficult, in that condition to kind of get through the day, so to speak, especially some days. But it wasn't anything that people felt was, even though it was chronic, it wasn't something that could be labeled with a name. So then I started doing a lot of research myself. And right before I met you, I think I started doing a little bit too much of Dr. Google, and I tried to treat myself, and I ended up being worse than better. And then I said, well, let me find somebody who could really help me. And, through, I guess, God's grace, I found you. And the way I found you was, as you experience these conditions, I started to keep a diary. I looked at the weather, I looked at what I ate, I looked at the moon, whatever it may be. Like, is there some type of pattern? And I really realized that it was around humidity that I felt the worst. So then I started, researching, can mold, I remember Googling, say, can mold live inside your body? And you can, right? And it came back, it can. And then that, I guess, led me to Surviving Mold website. And that's where I found your name, I think, referenced there. And I gave you a call. And, what I really liked about the approach that you took was it was very clinically based. So a lot of the other natural doctors that I went to, it wasn't, clinically based. It wasn't done on, urine tests or blood work. It was done through another, different means. And this, kind of either showed yes or no, right? So, we did the urine test, and, it came back and I had 15 times the levels that I should have of mold inside of me. Pretty startling, right? So we started the regimen, and, and I felt pretty, probably within 2 months of the regimen, I started feeling pretty good, on the way to recovery. But, what was interesting was what I thought I had one condition, which was mold. It turned out to be, I had co-infections. I had a compromised immune system. It pretty much was a bloody mess. I had Lyme disease. I have H. pylori, right? I mean, the list goes on in terms of, when your system's compromised, and I guess your immune system's weakened, a lot of things that your body would normally process, right, doesn't get processed, and they just kind of live there. And they're smart, right? They're smart. I mean, the things that I learned through you, sometimes they actually build up, I guess, defense mechanisms, and they attach themselves. Yeah.
Yes. Sorry. Yes. Biofilms.
Yeah.
So yeah, I mean, I had to interrupt you because you mentioned co-infections, and I just wanted to elaborate a little bit. Yeah, when we are looking at root causes of chronic illness, especially when someone has been suffering with a myriad of symptoms over the years, and like you said, you saw several traditional medicine doctors as well as naturopaths with barely any answers and any lasting relief. It was important for you and I to go in deeper and to get to all of the possible triggers for biotoxin illness. So that's why, we looked at all different kinds of toxins, not just mold toxins, right? We were looking at bacterial, viral, parasitic, fungal toxins, and we found quite a few infections and toxins, right? With the various tests. And yeah, that's where now my best part for me was when you at one of your, I believe it was your first or second follow-up, didn't take too long, that you started to come around, you started to feel better, and you said, Dr. Dashore, I haven't felt this good in years.
Yeah, that's 100% true. I was, literally, I was very limited in what I could do. Especially physically, exerting myself, especially around summertime. Everybody looks forward to summertime and getting out and doing things. And, for me, it was a very difficult time of the year because that's when I felt my weakest. And again, it was interesting. I still can't, I don't know the science behind it, so to speak, but when I was exposed, I guess, to the mold or to humidity and things got worse, I couldn't exert myself. I could barely cut the lawn. If I tried to cut the lawn, it was just very, very limiting in terms of what I could do. And then after I started the protocol, I was able to do the things that I used to be able to do. I'm still not able to run a marathon, but I am doing better, much better. And, I would probably say I'm about 80% of where I was. And I know there's a couple of things on the list that we still have to knock off that still lives inside of me. And I'm hoping that once we get past that, I will be able to, get back to relatively similar lifestyle that I had prior to the illness.
That's wonderful to hear, John. And, we have used a plant-based naturopathic approach. There's been no pharmaceutical drugs. And that is something that people need to hear, that, because many people, when they are exposed to mold toxins or Lyme disease and infections, they develop multiple chemical sensitivities, food allergies, Crohn's, colitis, environmental allergies, of course, and they are not able to really do well on pharmaceuticals. We know that for acute care, pharmaceuticals are required, but people living in mold long term, like for yourself, you had mentioned that you have a 100-year-old house. And plus you're on an island, aren't you?
Yes, I live on Long Island, which is prone to moisture. Yeah.
Correct. Yes. So people are not aware that a completely plant-based approach, can be a viable alternative to treating biotoxin illness. Lyme disease and co-infections, there is a really good herbal approach, that people are aware of, but not so much for the mold biotoxin illness. So I'm really glad, that you are helping put this information out there so that people will be helped, people will be made aware as well that there are options available.
Yeah, I think, my I guess call out to people, whoever may be listening to this, is that if you have a mysterious illness, do check out the biotoxins. There's a lot of things that you could be exposed to throughout your life, and it's really worth looking into. And it could be very eye-opening. And I think one of the things that you mentioned that triggered a thought is, I forgot to mention, like, environmental allergies were tremendous for me. If I pass somebody's house who recently had the paving of their driveway, or just driving the car, if I didn't put the circulation of the air internal, like any of that exposure of gasoline fumes would be very, 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 very difficult, for me. And one of the things that struck me was, I guess I had the mold inside my lungs as well, even though it couldn't be diagnosed, was my oxygen level. I always, found it interesting that I was at 95, 96. And, I'm an active person, always exercised, and I felt I should be higher. And now, since I'm getting the mold out, rid of the mold and whatever other toxins, it's up to like 98 now. And so it's interesting. You look at these objective measures, you can see some progress. So the blood work shows progress. Obviously, urine tests and other tests show progress. And then this was just something I did on my own, because I always just in the back of my thoughts said, I wonder why I have such a low oxygen reading. Given the fact that I'm a fairly healthy person. So anyway, just thought I'd share that.
Yes, yeah. We did nasal swabs, we did stool testing, we did cheek swabs, lots of urine testing, right, for various things. Yeah, and also blood tests. So
yeah, that's the one thing I got let people know as well, is I think the amount of lab work that you are aware of, like within your network of things that you could test for, is quite extensive. And really you deserve a pat on the back, because when I went for some of the blood work, that you asked for, they had to almost consult as to, they haven't really done this test very often. They had to consult as to what vials to use and some other things. And it took a decent, period of time to get the results back. So it was something that was kind of interesting to me. But yeah, extensive. I think it was like 35 vials of blood that initially was taken. So very, very thorough. So people should be aware of that. Very, very thorough, very clinically based. And, the facts are the facts, right? The blood work shows whatever may be going on. So it is very, very nice to see, not to have it, but to see that, you can name to something, and it's no more a mystery. It's defined.
Exactly.
I think that's it.
Exactly. Yes. It was all your labs, and we were able to customize your protocol according to what we found in those 35 vials and 7 urine testing and swabs and what have you. So we customized your protocol to you, right? Dosages, medications. Not only did we do that, when we did follow-ups, we are seeing improvements. In fact, recently we did parasite testing, and overall, I'm sure, you're a very scientifically based, objective person, as is obvious, I'm sure, to everyone watching, which is great, and you must have noticed that all the labs all different variety of labs that we did, different body fluids that we checked for you, on many levels, they corroborated with each other, right? We found soft signs of co-infections, soft signs of parasites in your blood work. We found obvious infections in your blood work. Then we found opportunistic infections in testing your gut. And then we found genetic susceptibilities as well in both of the genetic tests that we did. So that's the beauty of it. This is exactly what happened to, as you know, and since you read my book as well, this is what happened to my son and myself in the process. You say God's grace, and that's what it's been. My son fell ill, and in healing him, God's grace was that I found out what was wrong with me, that it really wasn't, your chronic fatigue or fibromyalgia and what have you. It was all underlying issues with so many co-infections and toxins and what have you. So
yeah, and there's no silver bullet. I think the problem with our modern world is that they think they can just take aspirin and be better. And with these type of illnesses that are, I never realized, I never thought there's so many different type of illnesses you could have at one time, and the layers of illness, right? And it's something that you have to be very, I think, deliberate and I guess faithful to in terms of the program and the protocol. But the results are there. I think the results are there. I mean, I feel it myself. And some of the herbals that you recommended, as soon as I started taking it, you can feel a difference. Like that herbal is doing something. But yeah, it's a very disciplined and very traditional type of, I guess, approach. Yeah, I have nothing but praises to sing about the way it turned out.
Oh, thank you. Very kind. Thank you. I was thrilled. I mean, I wasn't thrilled that you got COVID, but I was thrilled to hear that you did relatively well with just monoclonal antibodies. You didn't have to take any vaccines or heavy duty medications or, be hospitalized, because it was right in the middle there, right? Your entire family got it, and you actually got better faster than your son.
It was interesting. Yeah, I mean, it was just interesting that, I was a little bit concerned given the fact that I have such a compromised immune system, how I would be able to, and I think some of the herbals that I was taking along with it, may have helped as well. But yeah, it was about a week, maybe 6 days from start to finish before I was back kind of to normal. But yes, we survived, our family survived COVID, and good to point out.
Yeah, that was fantastic. Well, of course, the fact that you were on herbals. Now, I have children with autism all around the world who are, doing full customized protocols with the BioNexus herbals, and it's been interesting. Something similar has happened, like literally around the world, right? You may recall that there was this really heavy duty COVID issues in India and Pakistan. So my little kitties there, the whole family is really ill for a good couple weeks. And these little children with autism, who are supposed to be immune compromised, just did fine. They're running around. They did not lose the progress they had made on the protocol. And, until mom and dad and brother and sister got better. So yes, and that's pretty much what happened to me as well, because I've been infected a couple times, right? From different sources, my son, in the family, and I've recovered well overall with herbals. Yeah.
Wonderful, yeah.
Fantastic. So looking forward to running a marathon, you said? That would be awesome.
Well, not really. It's a figurative of speech, but it's just, I'm almost where I used to be. So I'm looking forward to, getting back, so to speak. Some of the things that I haven't done. I've exerted myself to much better than I have in the past, but I haven't, kind of unleashed, so to speak. Still a little cautious. So we'll see what happens, going forward.
Okay, wonderful. Well, one of these days, yourself, Joanne, myself, Brian, when I'm on Long Island, we should meet up for for, green juice.
Oh, yeah. Yes. Yeah, very good. Yes. Yeah. Very good. Any other questions, Dr. Dashore? Is there anything else that you think the listeners might be interested in? Anything that you feel I should highlight?
I'm thinking that you have done, really good job. One thing does come to mind. Can you talk a little bit about, you mentioned your energy levels are great. Can you talk about, you also mentioned that your allergies are so much
Yeah.
better, right? Now, can you talk a little bit about sleep and your gut health? I think that would be very helpful. Gut issues are so common.
Yeah, I guess I have H. pylori, right, which we're treating right now. We have the parasite that you're going to treat. So my stomach improved. So my gut health, I guess I had very bad digestion, a lot of bloating after meals and things like that. It was pretty tremendous. And then, now it's progressively got much better, but it's not the way it used to be before I ever got sick. So that's where I think, we're working through. Hopefully this last new protocol will take us to the finish line, and I'm looking forward to that. But sleep has been, I had a little bit of an issue with sleep, I guess, in the years that I had the ailment, but it wasn't something that I was tortured with, so to speak. Like, it wasn't that bad of a situation. The worst was that I used to get up, I guess, maybe 3-4 o'clock in the morning, and that's when I would have kind of just some type of reaction to certain. That has been, really been eliminated. My sleep now is very good, and my energy level has been tremendously improved. Before, again, I usually, cutting the lawn as a reference is, if I cut the lawn, that would be like, probably the only thing I could do for the day. Now I can cut the lawn, I can do other things. I can do, the energy level is just much greater. And then the allergies associated with it, right? Just being exposed to like the lawn grass before I would sneeze, I would just feel terrible, and now absolutely no effect. Absolutely not even sneeze, nothing bothers me. All the seasons I'm outside. So it's really, to me, it's pretty amazing how that that improvement has been realized.
All of your heart symptoms, your cardiac symptoms, like anxiety, flutter, heart racing, those have calmed down as well, correct?
Yeah, Right now it's very good. I also, that's parasitic related, and I know it's also tied to kind of like the full moon. So I'm a little bit more cautious around the full moon than I normally am. So I kind of learned to deal with it. I think once the parasite's gone, I think I should be normal there. I'm looking forward to being normal. But it definitely affected, the arrhythmia, tachycardia, even the high blood pressure at times, all were affected by these co-infections and the toxins in the body. It's amazing what it could do. I always marvel. The thing that marvels most, I think you told me, was that I enjoy outdoors. I enjoy being in the sun, and my body couldn't generate vitamin D. Right? These organisms that live inside what could eventually, I guess, hurt them, so to speak, right? So they put up defense mechanisms, and your body then can't build that vitamin D that you need. And even vitamin B, like I was really depleted on vitamin B and vitamin D. And even though I was in the sun a lot and I ate very well. And then, through the protocol, we've improved that, and looking forward to even improving that further. So.
Absolutely. Yep, me as well. Yes. So overall, you have gained, 80% of your health back.
Mm-hmm.
And yes, like you mentioned, looking forward to seeing you bouncing off the walls, so to speak.
Yes.
Good. Not to be taken lightly, John has really been a very compliant patient, with a lot of due diligence, with a pretty extensive customized protocol. John has also been very conscientious with his diet. So, it all matters on how strong of a drive you have to get better. Using only natural medicine, if you're so inclined. And the takeaway here, I think, John, is that it is entirely possible to have a natural-based lifestyle and, take care of your health, improve your immune system, and keep things going. I mean, you will be on a couple of vitamins and herbals even after I discharge you, just to kind of maintain the gains until you don't need them anymore. But I find that most middle-aged people like us, we enjoy the boost that we get from a couple herbals. So.
Yeah, they actually almost, I agree. Like they're almost addicting. Not that they are, but that you feel like you feel a little bit of, people enjoy coffee, right, for energy. These little herbal cocktails, they do, make you feel good. So I can see why people be attached to it.
Well, okay, cool. So I can't thank you enough, John. I really appreciate you taking the time on a Sunday to talk with me. And I know this will be helpful to many, many watching.
Yeah, that's my hope. I mean, the reality is, I know what it's like to be in the sidelines and, not know what's wrong with you and feel that, you're alone. And, the hope is this message goes out and someone else has a similar situation and they know that there is an alternative and that there is that hope and that hope that basically that they could get better and that they don't have to live in that condition because that could be very difficult for people. Yes. Great. Well, pleasure, connecting with you today.
Likewise.
And always a pleasure to see you. Yes.
Likewise, John. Well, go ahead, enjoy the rest of your day.
Okay. Thank you. You too.
And I'll see you soon, I'm sure.
Okay. Take care. Bye.
Okay, well, that was wonderful, wasn't it? John is so happy and bubbly and buoyant now that he's feeling better. It was a whole different story when I first met him. Well, it's that time again, and it's time to bid adios to you right now. So goodbye until I see you next time. Thank you for joining me. Be well, and until next time, namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.